My name is Edith Nakku-Joloba, and I'm an epidemiologist, and I'm a doctor working for the School of Public Health, Makerere University, and I also work at the STD clinic in Old Mulago, right where we are, where I work as a researcher and a clinician. I've had a lifelong interest in sexually transmitted diseases, and I was very blessed to win a NACHA grant where I was funded to look at prevalence of Neisseria gonorrhea and Chlamydia trachomatis among persons, both male and female, and their partners, and the partners of their partners. This study, the prevalence of Neisseria and gonorrhea study that we did in Ugandan STD clinic attendees, is among the first studies to characterize infection of Neisseria gonorrhea and Chlamydia trachomatis in a sexual network in Uganda. And then second of all, it's also one of the first to characterize the antimicrobial resistance of the bacteria we found, and also do the genomic sequencing of that bacteria. We did our study not only here at the STD clinic, we included many clinics in Kampala. We included Koma Mboga, we included Kasangati, we included Chisugu, KCCA clinic. We used KCCA clinics and Kasangati and our clinic here. And so these are people who are just walking in, as long as our criteria was that you are attending an STD clinic with symptoms suggestive, like you were complaining of maybe low abdominal pain, maybe some discharge, maybe something to do with your genital area. That was the criteria, and you had to be over 18.
The first finding was about how the gonorrhea and the chlamydia is transmitted throughout the sexual networks of these people that were infected by them, because we went ahead to do their primary partners and the secondary partners. Let me say, if I have gonorrhea, so we probe you for your primary partner, and if we get the primary partner, we also probe them for their secondary partners. So we really found out how this the STIs, the gonorrhea and chlamydia, are transmitted through that line in this age group. Yeah, and we also found out the other interesting things is how people are willing to bring up their partners or to disclose their partners, and those who were not willing at all to disclose their partners.
For the what we call the baseline group, the ones who came to the clinic, we found, I think it was high. There was more gonorrhea in the women than in the men. It was nearly 1.8 times higher in women. And this is not surprising. Previous studies have shown the same, that gonorrhea and chlamydia is likely to be higher in women. Why? Because of the biological makeup of women. Women, when men get gonorrhea, they get an inflammation of the urethra, they are sick. Within 3 days, they are very sick, and they go to hospital. Women, in a different way, when they get gonorrhea or chlamydia, the disease goes silent. Actually, people have called it a silent epidemic. And I was able to find that actually quite a number of people were infected. For Neisseria gonorrhea, we found 25% of the persons who we enrolled into the study. Then for chlamydia, it was 18%. Then we went on to look at their partners. So if you come in, we talk to you, you agree to be in the study, you sign the consent, we check you, and then we treated all the patients according to the treatment of the bacteria we had found. It was lovely. And then we asked them, can you take us to your partner? And then some people said yes, some people said no. Those that said yes, we found actually all of the people enrolled were able to, who are positive, because we didn't follow up the partners who are negative. If we checked you and you are positive, of the 25%, those are the ones whose partners we followed up. We had envisaged that the bag, if somebody is a person's partner and they've had a sexually transmitted disease, those bags should be similar. You understand? So we did the genomic sequencing of this bag and that bag. The bag we found in the person and the bag we found in the partner. And we found similarities. We did find co-infection. We did find co-infection with Neisseria gonorrhea and Chlamydia trachomatis in 5 people. where out of those, I think it was at the baseline, we found people who 5 of them were co-infected. And funny enough, okay, not funny enough, interestingly enough, when we followed up the participants, even some of the partners, some of them had the co-infection. We found resistance, which is very important. We found resistance to antimicrobials. We found resistance to penicillins in the gonorrhea. We found resistance to ciprofloxacin, which was a drug that was, and so our study is one of the first studies in Uganda to concretize and confirm ciprofloxacin resistance at a genomic level. Yeah, how it has changed my thinking and perspective is that, number one, it has made me realize that there's a lot more possible on the scientific front in Uganda, because some of the things I dreamed of doing when I was a master's student about 15 years ago, I was able to see them happen. At that time, they couldn't happen, but I think we've done a lot. So it's very encouraging for the young other researchers and other doctors in the medical field that the possibilities are endless, and they are right here in Uganda. And the other thing it has helped me to think about is that to dig for things to the bottom. And of course, I don't want to stop, but first of all, I should have done this in the beginning, to appreciate the participants in the study, because by allowing us into their lives and allowing us to do this deep delving, not only into their personal lives, but into their, allowing us to share their samples with us. They are still we got all the consents. And we are partners. Basically, for me, I've always known we are partners, but it has shown me that we are not only partners with our participants, but also partners with other scientists and also partners with the community, because we moved out and then had to consent those people. That was quite interesting. We consented at the first level, the baseline, then we also consented the partners. Very interesting.